Good afternoon, everyone, and welcome to our first video. We're going to entitle this Social Distancing with Rita. And I guess we should start by talking about the fact that you and I are not wearing masks. Shame on us. So why don't you explain why we're not wearing our masks today?
So we know how important wearing masks are in this COVID-19 period, and we are not wearing masks today because we think it's very important that you hear what we're saying and you also can see our lips move. That does not mean that when we leave this room, we will be wearing our masks. So very important to note that, Craig.
Yes. So let's start with some of the changes we're going to see tomorrow. Hopefully you've received your material. This video is part of the material received today, but why don't you give them a couple of the changes they're going to get to see on Friday, May the 22nd.
So it has been a daunting task to try and figure out what steps and how and when to reopen this community. So our leadership team has done an incredible job, and we've put together this re-entry plan. It's about 14 pages, and so we want to start sharing with you some of those phases that we are working on. So starting on Friday, we are going to be allowing visitors to come onto our campus for independent living only and to visit each other in our front lobby or our front parking lot area. Which is going to be very exciting. So we're going to have some designated pods set up so that you can enjoy safe visiting with each other. We are asking for some help. We need some help in making sure that we keep this community safe. As a result, we're asking for no more than 4 visitors, all over the age of 14, to come at any one time. In addition, we're asking no more than 2 residents to visit those 4 residents, so no groups larger than 6. Properly socially distanced out front. We will have pods set up. We're asking you not to move the pods, not to move the chairs, just to make sure that you stay in a very safe area. Masks will be required for both the visitors and also the residents. And so if you need some help in understanding what those masks, how to wear them, please let us know. We know it's very important for you to cover both your mouth and your nose when you are wearing that mask. And we also know how important hand washing is. So we're looking forward to having some families come back. We know how important that is. We can't wait to see, but very, very important that you help us stay within the guidelines that we're setting out today.
So why don't you, we've talked about independent living visitation. Let's address, while we're at it, the Waterford and the Health Center possible visitation.
Great. So we know that the Ohio Department of Health has given us very strict guidelines on visitors. And so we are working through a plan right now to allow window visits. We hope to be able to communicate that over the next couple of days for when our assisted living and assisted living and health center residents can see their families. Please be very mindful that no visitors are allowed in the campus whatsoever, and that the visits in the health center and assisted living will be through a window, and our Friendship Village team will help facilitate that for you.
All right, I think the next thing we probably want to discuss, about a week ago, we started allowing residents to have restaurants delivered to the village. Let's talk about now possibly them going out to pick up their dining.
Yes, so we know that in the state of Ohio, the outdoor patios and bars opened up this week, as did the restaurants. We feel very, very strongly that we want to be cautious and understand what's happening in the broader community before we say go and have a meal in a restaurant. As a result, we do feel like it's safe if you wanted to go and have a carry-out order and it was brought to your car where there was nobody that you have touched or saw or any of that, so you could have your meal delivered into your car directly. So we are going to encourage you, if that's something that you'd like to try, to go ahead and do that. Please keep in mind your masks are critically important, your hand washing to and from is critically important, and even wiping down the outside of your to-go items is important.
While we're on the subject of food, let's talk about groceries. I know, again, about a week ago or so, we had groceries starting to be delivered. How about picking those groceries up now?
Yeah, great question. So we are going to allow, again, curbside pickup for your groceries. Please do not go into the grocery store. Your groceries can be brought to you in your car. Please don't get out of your car, but we are encouraging, if residents want to do that, they can go ahead and do that. Also keep in mind that many grocery companies will deliver to Friendship Village of Dublin, and we still are implementing the Friendship Village DoorDash program here.
All right, let's shift gears a little bit. Let's talk a little bit about exercise. We know that's Jeannie and her team. Wellness is important, so what are some of the exercise activities they can do potentially around the neighborhood?
Yeah, so We have a lot of people who bike and walk. I just love seeing all the walking, and hopefully it's going to be nice this weekend and not raining like we're getting used to. But we think it's safe now for you to walk outside of the Friendship Village of Dublin premise. So if you wanted to walk to the park or to the greater Riverside Green neighborhood, walk through those areas, we think that that's a great option. We do not require masks outside, except for when you're visiting your family or when you're around people in an area. But we are encouraging you to consider wearing your mask when you are off the premise, especially if you're walking with somebody or through a park or something like that.
Another form of exercise, at least when I do it, is exercise, and that's gardening. We know we've got a lot of requests to the COVID email, better access to the building from our 2 garden plots. So can you speak to that, please?
Yeah. So keep in mind we have 2 entrances to the community that are open now, and that is an Ohio Department of Health regulation. We are asking people to still come through the front door if you leave the premise, but many of you have asked, when you go to the gardens, is it possible to go in and out of those doors that are easier for coming in from the garden area to the building? So between the hours of 10 a.m. and 2 p.m., we will be unlocking those 2 doors, and they're the doors by the fitness area in Ash Run and the Brandywine connector in the Riverstone area. Those are the 2 doors, and they will be open between 10 and 2 for your convenience. We are really going to have to work together to make sure that all people who come into the community and who are visiting or working or going off premise to go to a doctor's appointment do filter through the main entrance. That's going to be a critical component because we are logging and we're doing symptom checks anytime you come in the building.
All right, so that kind of completes the portion of our video that talks about the changes happening tomorrow. Again, tomorrow being Friday. Let's talk a little bit about then some of the changes we're going to start to see after the Memorial Day weekend starting next Tuesday. So let's start with those long put off doctor's visits. Can folks start doing those now and not be under quarantine?
So about 20 minutes ago, we got a message from COPC, and I'm sure a lot of other community physician groups, that they are now starting to open up their communities or their office for medical appointments. We know how important it is for you to go and get your medical care. So we also know that it's important that we monitor ourselves so that if we do have symptoms of COVID, we don't spread that. So starting on Tuesday, we are going to say that when you come back from a medical appointment, you no longer have to quarantine for 14 days, but we are asking you to self-monitor yourself for 14 days. And so, Craig, self-monitoring means that every day we will give you a sheet, and every day we're asking you to fill out your symptoms, if you have any of the symptoms of COVID, also take your temperature, and also do a pulse ox to monitor your oxygenation level. If you don't have a thermometer or a pulse ox, the front desk will help monitor your temperature and your pulse ox for you. After the 14 days, or if you exhibit symptoms, we're asking you to let Ava know, and we'll provide her contact information for you. After the entirety of the 14 days, we are asking you to turn your sheets in so we can keep those as a record.
All right, so that covers our medical appointments, dentist offices. I assume we consider to be that same way. How about if we end up in the hospital? What's going to kind of be our rules on the hospitals?
Yeah, so we hope no one ends up in the hospital. That's always our goal. But if for some reason you do, we learned that any Ohio Health hospital is doing a COVID test when you go into the hospital, regardless of why you're there. So we are asking that if you return to Friendship Village of Dublin within 48 hours of having a negative COVID test, that you do not need to quarantine yourself. But again, you'll have to self-monitor with the form and the procedure that we just spoke about. If you do not have a COVID test while you're in the hospital and you return, or your COVID test is outside of that 48-hour period, we are asking you to self-quarantine for 14 days. And the reason that we're asking you to do that is we want to make sure that you don't exhibit symptoms and or help the community stay safe.
Right, so then let's talk about those folks who fortunately or unfortunately went to the doctor this week, so now they're under a current 14-day quarantine, which may run, let's say, through June the 1st. Gee, if I'd have gone next Tuesday, I'm not on a quarantine. What should those folks do? Let's say they're on day 7 next Tuesday. What should they do for the rest of their 14-day period?
So we are asking again that you monitor yourself for 14 days in your entirety. So you need to stay in your quarantine until Tuesday, and if on Tuesday, if you have any remaining days, we're asking you to monitor yourself via the self-monitoring tools that we just communicated, the log that we will hand to you, your temperature and your pulse ox and symptom management. So if you come back on Tuesday and you have 7 days left of your 14-day period, you would not be restricted to your apartment. You could use the entirety of the community, but we are asking you to monitor yourself for the remainder of those 7 days.
All right, so that's the changes for Tuesday that are medically related. Let's talk about the fun stuff now. I hear the fitness center might be opening. Give me the details.
Yes, the fitness center. We know a lot of you have really communicated that that's an important piece of your life here. And so while things have changed a lot, we want to try and provide some safe normalcy to your life. So starting on Tuesday, Monday is a holiday, Tuesday at 7:30, the fitness center will open, the wellness center will open with on a very limited basis with guidelines. Starting now, you'll be able to sign up for a fitness or a block of time in the fitness center. They'll be on, I believe it's the half hour, but it could be the hour. I'm not sure of those details. And we're asking that your workout is less than 45 minutes and that you are allowed one workout per day. The extra 15 minutes, so if your workout is between 8 and 8:45, we'll use the 8:45 to 9 to disinfect the gym using all of our disinfecting tools. The gym will be limited to 3 people, the actual treadmills, the workout area, and then the larger fitness area with the bamboo floor, that will have some limitations as well, and they'll be blocked off in the front entrance for you.
Yeah, so for those of you, so we know there's some that like to work out multiple times a day. We are at least asking here in this initial phase that you limit it to one time a day, because there's only a certain number of people that can be in the wellness center at a given time, that everyone has a chance basically. So if it turns out after a week or so there's room, we will certainly change that policy, but at least initially.
Yeah.
So let's talk about, with that, how about the pool? Does the pool and the wellness center go together? Those kind of staggered openings there?
So like many of you, we've taken this opportunity to do a little spring cleaning, and the pool is one of those things. We had some tiles reset, I guess is what they call it, and some of the pool areas fixed. The pool doesn't have any water at this point, so it would be a little chilly for Tuesday. So as part of the re-entry plan, we will communicate moving forward that is an area that we will allow limited visits, but unfortunately it's just not going to be ready on Tuesday.
Not going to be ready by Tuesday, but stay tuned. It's maybe the next week to 10 days after Tuesday. If we get some water in it, get the chlorine levels right and the heat on a little bit, we'll do that. So that's all the things that are going to be opening, or all the new activities, but we don't want to ignore what's going to be in phase 2 and phase 3, which we're not quite ready to publish yet. But let's talk a little bit about the culinary team and their dining rooms. Give us a best guess as to what that might look like and when maybe we'll be able to eat in the dining rooms again.
So the dining is a hard piece of the puzzle because you can't wear your mask while you eat, and the dining room doesn't necessarily encourage social distancing. So we have, as part of our re-entry plan, have put together a very specific re-entry process for every department, culinary is included. So we don't expect that the dining room will be open in the next 14, maybe even 30 days. We'll have to monitor and see how things go. But it is really important to us for you to be able to use the dining room when it's safe to allow that.
Yeah, and I guess I got a little ahead of ourselves there, because as part of culinary, I believe there is a change happening on Tuesday. So would you give us a little bit about what's going to be possible for our residents to do on Tuesday?
Yeah, so we have some really great spaces, some outdoor spaces that we want you to be able to utilize, specifically our new courtyard that we opened up in October and then it got chilly. So the tables and the chairs have been set up, so if you would like to take your outside meal or your meal that has been delivered to you to go and eat outside, we think that's great. We're asking for no more than 2 people at a table, and in the banquet areas, again, no more than 4 in that area. While you're eating, obviously you can't have your mask on, but if you're just sitting and enjoying the weather or the flowers that Andy and his team have planted, we are asking you to wear your mask. So that area is open, so we hope that you enjoy it. It's a really nice space that we are excited about via this master plan.
Yeah, and I guess the last thing that we get starting to get a number of questions on, how about apartment cleaning? When are we going to turn the ESS team loose to get back into the apartments and clean some of our apartments, our resident apartments.
Yeah, we get a lot of comments on this, don't we, Craig? So housekeeping is an important thing. We want to be very cautious as we open up the community. And again, we've been very fortunate and very lucky that we haven't had people who have been sick or showing signs and symptoms of COVID. We also know that the greater community is opening up and that there's a strong likelihood that we're going to see a surge in cases and symptoms. And so we want to be very, very aware of that. Housekeeping is a hard thing because one housekeeper goes into 9 apartments per day. And we know that the symptoms sometimes don't show up for up to 14 days. So we're a little hesitant to put housekeepers into the apartments only because of the outside risks. So we know how important it is, and I think one of our residents said that he absolutely detests cleaning, and we know how important it is, and that in many of these areas have been not cleaned in many times. So if there is a specific instance and you really need some help with housekeeping, please let us know. We'll do what we can to accommodate it. But at this time, for the near future, we'd like to monitor and see the situation before we put a housekeeper in your home for you.
Okay, so it makes sense. So we've tried to keep this video positive, but let's go back to revisit the quarantine. We've kind of given all the avenues to not be in quarantine. There are still some activities we don't feel as certain about or our residents can do as safely. So give me the activities that are still going to require the 14-day quarantine.
Well, like Craig needs his haircut, maybe a shave, we'll see. But the salon is an area that we have been looking to open. John Holland, our salon partner, is putting some really safe parameters in place for you. But if you do go off campus to have your hair cut, we are asking that you have a 14-day quarantine period. Also, if you go into a grocery store, if you go into a restaurant, if you go to your family members, we know that your family members are practicing very, very safe measures, but it's just very hard to know what the right answers are. And so for right now, we're asking that anything that if you go off campus for any reason, with the exception of a medical appointment or to pick up your groceries, that we're asking you to quarantine yourself for 14 days.
So let's talk about some specific examples for this coming holiday weekend. Visitation at our front entrance outside with masks, with social distancing allowed.
Perfect. Can't wait to see everyone.
I want to go to my son or daughter or my grandson or daughter's home for an outside barbecue. I'll wear my mask. Am I allowed to do that?
So at this time, because of the risk outside, we're asking people not to leave the premise unless it's medically necessary or to pick up the food. And we know how challenging that is, especially when you haven't seen your family and your grandkids and your great-grandkids for so long. But right now, just to practice extreme caution, we're asking you not to do that.
Okay. Anything else you want to wrap our video up here? This could be the first and last social distancing with Rita video. We don't know if there'll be a number 2.
Yeah.
So anything else you want to leave our residents with this afternoon?
So we know this has not been easy. We know it has been hard and it's not fun. I don't think any of us are having fun.
No.
But I hope that you know that we're genuinely trying to make this as easy as possible on you, but also keep you safe. We also understand the importance of letting you have your lives back. We know how important that is, but like all of us, we've all had to make some really hard sacrifices for this. But we have a 13-page re-entry plan that we have spent a lot of time and analyzed. But Craig, we don't know all the answers to this. We don't have all of the things that we need on how to kind of work through these next couple of months. And I think it's also really important to know that if and when we do have a case of COVID, that we will go back and practice what we've been doing with very extreme measures to make sure that the spread of COVID doesn't happen here at Friendship Village.
So I guess to wrap up then, let's talk about, this will be a phasing process. We have specifically not assigned dates to any of these phases. So what we're announcing today to go into effect basically tomorrow at this point for some of these changes is in effect for the next couple of weeks. There's no real official time frame around that. And that's on purpose, again, to see what's going to happen in the greater community and really all of Central Ohio as the rest of us largely, potentially, if we feel free, go to restaurants and grocery stores, etc.
And I will just add that we hope that we can have these things happen sooner rather than later. But
Absolutely.
we want to just, I think early on, Betsy indicated that in a pandemic, you look back and you think the sky is falling, and then you look back and you say we didn't do enough. And we want to do everything that we can to keep everyone safe.
Well, Rita, thank you.
Thank you.
Residents, great to see you via social distance, and we look forward to our next visit. Thank you.
Have a good day.